The trial involving 4 Albertans arrested during the Coutts blockade has been gaining attention.
When Coutts happened and when Ottawa happened, the Federal Minister of Health was about to mandate a booster every 3 months. That was on the table. Those people stopped that.
Advocates argue that these 4 individuals are detained on exaggerated charges with political motives to allow the Liberal government at the time to justify enacting the Emergencies Act to quash the peaceful protests that erupted across Canada.
So 560 days later with no trial date in sight, this is political and it's got politics written all over it.
Accused of conspiring to murder our CMP officers, they have languished in remand for over 1.5 years with neither bail nor a verdict.
We have people who've committed far more serious crimes who are out on bail.
Tony Olynyk, one of the 4, exemplifies the subpar health care that inmates grapple with in Alberta's correctional facilities.
I couldn't walk for a couple weeks, and not being able to walk while being in jail sucks, so I'm like pretty much bedridden in a cell.
Tony isn't even allowed to get prescription medicines for his intestinal issues. That's insane.
His distressing ordeal underscores a desperate situation in which loved ones find themselves as government agencies shuffle responsibility amongst themselves.
Tony's only an accused man. He's not an incarcerated man. Incarcerated men have better health care than Tony.
My name is Nikki Tom. I'm a very good friend of Tony's. He has actually asked me to advocate on his health. He's not getting any help in the remand center. I have contacted AHS. I have a file number for Tony. I've been on the phone probably 15 or 20 calls with a gentleman at AHS. Have got nowhere in over a month and a half.
To gain a comprehensive understanding of the situation, I reached out to both the Health Ministry and the Premier's office with specific inquiries about Tony Olynyk's situation and the claims made by Nikki.
He has asked many times for a probiotic. His probiotic was issued in the Medicine Hat Remand Facility. He was then transferred to Lethbridge and Calgary, and apparently the prescriptions do not follow them. I did ask AHS, so what happens if somebody's a diabetic? Does the prescription not also follow them? And they said, well, of course it would. And then I had said, how come a probiotic doesn't follow them? He's asked for a probiotic, and they have said it's non-formulary, not approved. Here is a form saying at one point his probiotic was issued. He's in this form asking for the probiotic, begging for health care, that his basic human rights are being denied, and it basically says no. This one, I contacted Tony's naturopath to see how he could be treated. That was something formulary from Alberta Health Services, so he did ask for mag citrate. Here in the sheet says, sorry, mag citrate is non-formulary. Under Alberta Health Services records, magnesium citrate is formulary, and he has been denied a formulary product by AHS, so they are denying him access to health care.
A check on the Alberta Health Services website indeed confirms magnesium citrate as a formulary drug, contradicting the response given to Mr. Olienick. For clarity, I reached out to Alberta's Health Ministry. The question specifically revolved around the medical evaluation of Mr. Olienick, treatment protocols, the discrepancy surrounding magnesium citrate status, potential alternative treatments, the ministry's measures, and their stance on Mr. Olienick's claims. Despite providing a clear time frame, I've yet to receive any answers.
Tony has sent me documentation for me to speak on his behalf. I have since reached out to MLAs, the Health Minister, the Minister of Justice, Danielle Smith's office, because she oversees these ministers. I was told from the Secretary at Danielle Smith's office that I was unreliable, unbelievable, and uncredible. My husband's aunt had phoned the following Monday, and Danielle Smith's office had said, I wish you people would stop this conspiracy. AHS is very reputable, and this would never happen.
Despite being given a 48-hour window to respond, neither office has provided a comment or clarification.
His last day of court, he said he actually didn't know how he was going to make it through the last few days because he was in such pain sitting in that courtroom from not being treated.
If every word from Nikki rings true, this could very well be just another example of incompetency and lack of care within Alberta's correctional facilities.
This is a disaster, and people have been trying to expose it for years with no avail because the politicians won't listen.
The state of neglect in Alberta's institutions is no secret, but another layer deserves our attention: With Tony detained for an astounding 570 plus days without a final verdict and having been denied bail, many consider him a political prisoner. During our interview, we received a call from Tony himself.
People that are innocent are not getting health care, and it's a travesty.
Tony recounts his history with a gut disease that was addressed by a naturopath through diet and natural remedies in Calgary when he was a free man. However, he says that the neglect of his medical needs behind bars has set him back several years.
Following her way, diet plan, and her natural remedy that cured my issue with my guts, suffering from a thing called SIBO, small intestinal bacterial overgrowth. And I believe a lot of people suffer from this. But mainstream here, especially HS, just doesn't recognize it. They just think, oh, you're just a regular inmate. All you want is some free drug they may just try to prescribe to you what they think you need. And I was just appalled in the sense that they were like, oh, you just need to take an antidepressant. And I'm like, I'm not depressed. I'm not stressed. I'm none of the above. I'm just, concerned that I just am not getting the proper dietary meals to help my body digest properly. So it's very frustrating. I'm going to be picky on what I eat, and I try to trade off all the sugary sweets for stuff that's more healthy, for salads that we do get here and there, which is kind of nice. But then a lot of times, again, it seems like the jail, for an example, is a horrible way of keeping tomatoes and apples and fresh fruits. They seem to throw them in the freezer, and a lot of times they come out freezer burnt. So you get a good run of fruits and vegetables, and then the next few days they're all pretty much like soggy and gross right out of a freezer. So it's been a challenging uphill battle, to say the least, to try to maintain gut health and still fight with the system. And HS calls a shot here, but sadly the jail should still provide health, especially if my naturopath has diagnosed it, my situation. And all I'm asking for is a probiotic. I'm not asking for any nefarious drugs or anything like that, even though they're the ones that want to give them to me. They immediately say, well, if you start getting real cramps and pain, gladly prescribe you some kind of pain medication. I'm like, that's not the problem. Like, stop trying to, force stuff on me that doesn't make sense. I'm just looking for a probiotic. It's pretty simple. And then the fact that they did give me one, they prescribed me one, then all of a sudden out of nowhere redacted their formulated policy, and they said, oh, we pulled it off our list of things to prescribe. And when they showed me the list, there was all kinds of probiotics, and even things like ginger root tea. They used to be able to prescribe inmates if they were having, upset stomachs or something, but they even removed that because it's not a formulary prescription. So what does that mean? Does that mean that they just because they don't have a contract with that particular company providing those products, then that's why they don't prescribe them anymore? Follow the money is where it all leads to, I believe. And I think somebody's profiting off the misery of not just me, but multiple inmates throughout the whole jail system. And Big Pharma and HS have something to do with that for sure.
You haven't been convicted of anything. You're innocent until proven guilty. So why are they treating you the way they treat you? Do you feel discriminated?
I feel let down by the system. Yeah, the system treats pretty much you like, you're guilty before you're innocent. And that's totally wrong. And no matter what it is, and no matter who you are, you shouldn't be treated like that if you live in a democratic free country like Canada, supposedly.
Tony states that the neglect of his gut health has led to more severe health complications, such as triggering his gout.
It did trigger my gout, and so my big toe would all swell up, and I couldn't walk for a couple weeks. And not being able to walk while being in jail sucks, so I'm like pretty much bedridden in a cell, can't do anything, and relying on a cellmate, to go and get my meal trays for me, and it's pretty, it's not the greatest feeling, put it that way.
You were physically unable to walk?
Yeah, there was times I just spent the whole days in my cell just sitting there and reading, and not couldn't be able to do anything. Unfortunately, I had a good cellmate, like I said, to go and get me my meal trays, because literally my toe swells up so bad that you couldn't even put pressure on it. You couldn't even put a bed sheet on it because it would hurt. The worst pain you could ever imagine. Terrible pain.
Do you have a plea to your elected representatives, to the Canadian people?
You have 1 minute remaining for this call.
I would just like them to hopefully grow some more awareness on our situation that will help benefit other inmates that are still Canadians, and hopefully they have some sympathy and want to help, because if they could, it would make a bigger difference. We'd have less people in and out of this system, and it'd be a less burden on taxpayers, and it would be greater good for society.
Oh, we've lost him.
Tony's ongoing suffering has not gone unnoticed.
No prisoner of war would be treated in the same manner as these men. The Geneva Convention.
While we were unable to obtain clarifications directly from the provincial authorities,
Prisoners of war.
a concerned individual from Sylvan Lake took it upon herself to confront Alberta's health minister regarding Tony's conditions.
Okay, well, I heard yesterday afternoon that she was going to be speaking at a town meeting in Sylvan Lake, Alberta, and that's only 20 minutes from my house. So I felt compelled that I had to go to this meeting and speak for these men, because I'm just one more person in the stitch in the quilt of freedom.
We have 4 men in a remand center for 558 days today. They do not get health care.
Tell her that they are being treated worse than prisoners of war.
We have 1 man in there who has a disease called SIBO. He needs probiotics, something that can be purchased at a drugstore over the counter.
She asked about these men, what their names were and where they were. I told her their names, what remands they were in, and I told her about Tony's health issues with his SIBO. I told her that he should be able to get probiotics to treat him.
What is your assessment of this situation?
Total confusion, to be honest. We all deserve health care. And like Tony had said to one of the nurses, I'm innocent until proven guilty. I deserve health care. And even if you're incarcerated, Tony's only an accused man. He's not an incarcerated man. Incarcerated men have better health care than Tony. Just because he's an accused man? What if this was your son? Would you people want him to have help? Of course you would. So please contact, if you wish, the Health Minister of Alberta, even the Justice Minister, the Alberta government. Please reach out to them through email and phone and ask them about Tony Olynyk's health. And say to them, what if this was your child? What if this was your brother? Please help him. That's all we're asking. We're not asking for government to interfere on something. What we're asking is the government to do their job and to help Tony. Please help him. That's all we're asking. Just please help this young man.
Thank you very much.
And I'd like to thank you, Mocha. I love you. And if you can support Mocha, please support him. This young man is working endless hours, and we need an honest young man like him out there. So please keep Mocha going.
Thank you. I appreciate that endorsement. Thank you.
Love you.